Hello everyone. So in today's lecture we are going to discuss about beta blockers, their mechanism of action, their classification, dose, drugs name and indications along with contraindication. Obviously we will discuss about their side effect and our favorite part, that is nursing consideration. So please keep your notebooks, diaries ready with pen and pencil to note down the important points, concepts and nursing consideration points if you want to clear NCLEX RN exam and a government job exams, nursing officers exam. Watch this video till end. Do not skip any point because this video is going to be your life changing video, as you will remember beta blocker category forever and ever. So first of all we will discuss about introduction of the beta blockers, which are also known as adrenergic receptor blockers and are predominantly used to manage the abnormal heart rate, abnormal heart rhythm, heart attack, especially in order to prevent second heart attack, which comes under our secondary prevention, and they are commonly or widely used to treat or prevent high BP. So what we see that these drugs are basically also famous as antihypertensive drugs and are very good antagonist which block the receptor sites. For what they block? They block the receptor sites. Please note from my left side, they block the receptor sites for endogenous, which is made in our body, endogenous catecholamines, especially epinephrine and norepinephrine, also known as adrenaline and noradrenaline of the sympathetic nervous system. As we had already discussed in our anatomy section that the sympathetic nervous system is responsible for increasing many activities in under the fight and flight mechanism, so that our body can handle stress or manage the stressful condition properly in order to maintain the homeostasis of the body. So some of these we can say beta blockers are selective. What do you understand why the word selective? Selective simply means that these selective beta blockers can block only specific beta 1 receptors, beta 2 receptors or beta 3 receptors, while some are we can say selective beta blockers and they can obviously act on our beta 1, beta 2 or all of them, including, please note it down, including alpha 1 receptors. So what do you understand why the word beta receptors? Many students get confused with the beta 1, beta 2 and beta 3 receptors. So you must note on your notebook and diary that beta 1, first of all we will discuss about beta 1 receptors, that beta 1 receptors are present mainly or located mainly in the heart and the kidneys. Guys, students, please note beta 1 receptors are primarily located in heart and kidney. We will discuss in a very short time after this how it is going to work, but every student should be clear in his mind about the location of beta 1, beta 2 and beta 3. It is very useful because majority of the nursing, medical and pharmacological students cram it up cram it up, beta 1 blocker, beta 2 blocker, beta 3 blocker, but they are not much clear about the concept of these receptors, where they are located. It is a very common or general question asked in the, we can say, in the term of general knowledge, MCQ, NCLEX RN and government job exam. So you should be very clear about this. Now, where are the beta 2 adrenergic receptors? They are, beta 2 receptors are located, noted down on the lungs, GI, that means gastrointestinal tract, liver and uterus. They are also present on the vascular smooth muscles. When we talk about vascular smooth muscles, we know that each blood vessel has middle layer having smooth muscle layer or tunica media. So these smooth muscle layers are having beta 2 receptors. Beta 2 receptors are present on vascular system. Please note, vascular system has beta 2 receptors. Also including skeletal muscles. So beta 2 receptors are present on lungs, GI tract, liver, uterus and vascular smooth muscles plus skeletal system or skeletal muscles. Now in the last, beta 3 adrenergic receptors, they are primarily located in the adipose tissue or fat cells in the body. So this was the short discussion about the clear-cut, crystal clear concept of beta 1, beta 2 and beta 3 adrenergic receptors. Understand? Everybody clear about this? Anybody having any doubt, you can ask in the comment section. So now we will move to the next section, that is in order to understand more about the beta blockers, about the mechanism of action. So now after the discussion of the types of different type of receptors, now you can see behind me on the whiteboard that now we are going to understand about mechanism of action. So what did really these beta blockers do in our body? So their mechanism generally covers blocking of the sympathetic receptors in the we can say sympathetic nervous system, especially in the heart and the kidneys. As we had previously discussed that beta 1 receptors are present on the heart and the kidney. Heart and the kidney are having beta 1 receptors. So these beta blockers generally block these receptors on heart and the kidney. So basically what will happen if we are going to block the receptors on the heart? So as we generally know that the SA node and AV node, conduction system of the heart, plus our myocardium layer is having beta 1 receptors. So when these beta 1 receptors are stimulated by the norepinephrine and the epinephrine, the contraction ability of the myocardium layer increases. Contraction ability of the myocardium layer increases, leading to increased loading of calcium in the myocardium layer. Generally, I am talking about physiology of muscle contraction. So we already are having a video on physiology of muscle contraction, and most of my students know about physiology of muscle contraction. So it includes loading of calcium ions in the muscle cells. And obvious, this will increase the cardiac output. Cardiac output will increase when under the fight and flight mechanism, our sympathetic nervous system, yes, our sympathetic nervous system is our friend, and it will increase the sympathetic activity. And obvious, it will increase the cardiac output, contraction of the heart, stroke volume, I want to say that my motive is to say that it will boost the cardiac activity. What if we block this SA node AV node conduction system, unloading of the calcium ions in the myocardium layer? If we administer beta 1 blockers, these drugs will block the cardiac activity, and obvious the cardiac activity will decrease. Cardiac activity will decrease. So it is quite clear to all of you that beta blockers, beta 1 receptor blockers generally block the conduction system of the heart and the contraction of the heart and its myocardium layer. So when we talk about kidneys, we know that kidneys are having juxtaglomerulus apparatus or JG cells. These cells are having receptors. These cells are having receptors for the epinephrine and norepinephrine. Okay, everybody clear till now that JG cells in the juxtaglomerulus apparatus are having receptor for the epinephrine and norepinephrine, adrenaline or noradrenaline. So whenever there is sympathetic nervous system activity from the T1 to L3 lumbar vertebrae, there is, we can say, thoracolumbar outflow. Thoracolumbar outflow is there and it is going to stimulate the JG cells. JG cells, when are stimulated, they release, yes please, renin. And we already know that after the release of renin, it will start RAAS, renin angiotensin aldosterone system. Yes please, can anybody in his or her mind explain what is RAAS? I am stopping this lecture for 2 or 3 seconds. Yes, it includes release of renin, conversion of angiotensin into angiotensin 1 and then into angiotensin 2 by the ACE, we can say enzyme, angiotensin converting enzyme in the lungs. Yes, you are right, in the lungs. So this is going to increase the BP. This is a normal physiological reaction by the sympathetic nervous system, that whenever there is danger, it boosts the cardiac output and increase the RAAS activity to increase the BP, blood pressure. Obvious, whenever there is a danger. For example, a tiger is behind me and I have to run very fast. My heart is going to pump blood, oxygenated blood, to all of my skeletal muscles and my kidneys. In the kidneys, juxtaglomerular cells under the sympathetic nervous system stimulation is going to release renin, which will boost or increase the BP. So what did we learn till now? We learned till now that whenever there is sympathetic activity, these organs are stimulated. And when we give beta blockers, my dear students, when we give beta blockers, these drugs block the beta 1 adrenergic receptors on the heart and the kidneys to decrease renin production. When the renin production decreases, this will obviously decrease angiotensin 2 and this will decrease blood pressure. When cardiac activity decreases, it will decrease cardiac output. So till now we had discussed about the, we can say, activity of the heart and the kidney, including its normal physiology. On the same time, I had told you about the activity of mode of action of mechanism of action of beta blockers, how these drugs are going to inhibit their stimulation or its activity. Now we will discuss about other organs also. Coming to other organs, first of all, we will discuss about the eyes. So under the normal, this is for the normal physiology. I have to remind you, this is for the eye. And under the sympathetic nervous system activity, eyes increase aqueous humor production, by the, yes please, ciliary body will increase the aqueous humor production. And when we administer beta blockers, it will inhibit aqueous humor production. So what do you understand? Whenever there is increase in the aqueous humor production, it causes, yes please, glaucoma. So our beta blockers are quite useful for patient with glaucoma. Excellent, good. So in the eye aqueous humor production is there. If it increases under the sympathetic nervous system activity, we will block the beta 2 receptors. My dear students, please note the name of the receptors along with beta 2 receptor blockers. We will administer and it will decrease aqueous humor production. Whereas in the sympathetic nervous system activity, we can say pupil dilation. Whenever there is a tiger behind me, I have to capture as much as light as I can while I am running. So this pupil dilation is caused by alpha 1 receptors. Ladies and gentlemen, we are discussing about the future of your nursing students, future of medical students, pharmacological students. Note everything very crystal clear. Watch this video over and again. This will help you to remind everything crystal clearly. So pupil dilation is under the alpha 1 receptors. By the alpha 1 receptors, when epinephrine and norepinephrine act on it, it show pupil dilation. So after the eyes, we had already discussed about that is heart and the kidney. We had already discussed heart and kidney. So after that, there is the number of next term is of lungs. So when we can say sympathetic nervous system act on the lungs, it causes, that is the stimulation of beta 2 receptors. Lungs are also having beta 2 receptors. My dear students, beta 2 receptors. Okay, so whenever there is a sympathetic stimulation, this stimulation is causing the lungs to be, we can say, having increased ventilation. So if my trachea, bronchioles, primary bronchiole, secondary bronchiole, tertiary bronchiole are having this, we can say, size of diameter, the sympathetic nervous system, with the help of adrenaline and noradrenaline, epinephrine or norepinephrine, will increase the diameter of bronchioles to this much. So what will happen when I am running before the tiger is behind me and I have to take deep breathing? So all of my bronchioles, tertiary bronchiole, primary bronchiole, need to be widen up, increase in their diameter. So beta 2, we can say adrenergic receptors will increase the size for ventilation. But on the same side, please note, on the same side, if we administer beta blockers, beta 2 receptor blockers, they will cause decrease in the size of bronchioles. So we can say bronchoconstriction. Yes, bronchoconstriction. The bronchioles will tighten up. Do you think it is, we can say, good for patient with asthma who is already having constricted bronchioles? Is it good for patient with COPD? Is it good for patient with lung cancer? No, absolutely no. So keep in mind that these beta blocker drugs are contraindicated in these patients. My dear students, these are contraindicated. Please make we can say cloud like structure near your nodes, and add point to remember, extra, add up whatever you want to add, but highlight it with highlighter, highlight it with red pen, blue pen, black pen, use color pencils, make every concept clear, crystal clear, like transparent glass. Whenever there is knowledge, the light of the knowledge enlightens your mind, enlighten your life and job prospects. Ladies and gentlemen, my dear students, we learn that whenever there is we can say sympathetic activity, lungs ventilate, hyperventilate, and after administration of beta blockers, bronchoconstriction will occur, which is very harmful further for these patients, COPD, asthma, etc. So after the lungs, then comes our GI system. So what do you think that if, for example, I am eating a burger on McDonald's, and suddenly a very powerful big size dog is behind me, and I have to run. For saving my life, I have to run. So did my brain believe in digestion, that one should digest his favorite item, burger or pizza? Absolutely no. So what will happen? The beta 2 receptors present on the stomach, intestines, large intestine and small intestine, duodenum part, will decrease GI motility. GI motility will decrease whenever adrenaline, noradrenaline, epinephrine and norepinephrine act on these receptors, beta 2 receptors on the gastrointestinal system. The motility decrease, peristalsis movement will decrease. Obvious, there is no need of the blood supply to these organs, and blood is required by the skeletal system for running, for saving life. Nobody wants to eat burger, digest burger, enjoy the taste of the burger before a tiger. It will be a funny situation, you know. So GI motility will decrease, and if we administer beta blocker for this condition, it will block the GI receptors. Beta 2 receptors will be blocked, and GI motility will be opposite, it will increase. Yes, it will cause diarrhea. So here comes the nursing consideration, that if the patient is having beta blockers, educate the family members and the patient about the side effect of the beta blockers, especially beta 2 adrenergic receptor blockers. Beta 2 receptors are present in, yes please, lungs, GI, liver, uterus and blood vessels. Please keep on reminding yourself that where are these receptors we can say are located. So after the GI we can say motility, now comes the term of, that is, yes please, now comes the term of liver. So whenever there is a sympathetic nerve activity, sympathetic nervous system stimulation, the liver believes in release of glucose, and then gluconeogenesis is the formation of glucose from the please note, everybody is not having these concepts clear, from non-carbohydrate sources. Whenever your liver make glucose, for example from the fats and amino acids, proteins, this is called gluconeogenesis. So in the liver we are having beta 2 receptors which increase gluconeogenesis, therefore increasing the blood glucose level. blood glucose level will increase in the liver under the sympathetic activity and stimulation of beta 2 receptors. On the opposite side, beta 2 receptor blockers will decrease blood glucose level, so obvious, whenever there is a decrease in blood glucose level, it will cause, yes please, fatigue, weakness. Don't you think that the nurse requires consideration here? Nurse requires focus. That patient is feeling fatigue, weakness, and risk for injury due to fall. Orthostatic hypotension can be there. Note it down by extra knowledge. Orthostatic hypotension can occur if there is, we can say, low blood glucose level or hypoglycemia. That is also called hypoglycemia. Ladies and gentlemen, please note. Pharmacology should be crystal clear, should not be crammed up. So till now we had discussed about many organs such as eyes, their sympathetic activity, and role of beta blockers. Lungs we had discussed, GI system we had discussed, liver we had discussed, pancreas now we are going to discuss, and after that blood vessels. So now is the term of, yes, our favorite, pancreas. Pancreas is favorite? No, pancreas is not favorite. Everybody's favorite topic is heart. My favorite topic is nervous system. It gives you challenges, it gives you problems. I want to face or learn new problems as with new curiosity, refreshment of the knowledge. Don't be stagnant in your life. Don't be stable. Always be ready to learn new things. So when we talk about pancreas, it stimulates the glucagon formation. Pancreas stimulate the glucagon formation. So it will further break down the glucose, convert the glucose, and increase the blood glucose level. So it is also our friend, glucagon. So glucagon will increase formation of glucose. Similarly, on the opposite side, beta 2 blockers will act on the we can say delta cells of the alpha cells of the pancreas and decrease blood glucagon level. It will decrease, yes please, glucose. So very simple, very crystal clear to understand. In simple, we can say lucrative way. You should learn as much as you can, as this is the age to grab more and more knowledge and enjoy later in the life. Okay, so now comes the last organ, that is blood vessels. So everybody knows that blood vessels in the body are having, yes please, the smooth muscles in them. The blood vessels are having smooth muscles in them, and these smooth muscles, or we can say inside of the blood vessel, is having endothelial cells. I had discussed these cells in so many lectures. So blood vessels are having tunica media of smooth muscle layer and endothelial cells on their innermost layer, that is tunica intima. So whenever the blood, as we know that blood is flowing inside the blood vessel, and this blood is having, yes please, we can say chylomicrons or triglycerides are present in this blood. Everybody knows about portal system. Under the portal system, nutrients are broken down into the simple form by the liver and transported across the body through the blood with the help of blood plasma. So blood plasma is having triglycerides as nutrients, and the endothelial cells and the endothelial cells are having, these cells on the walls of the blood vessels are having an very important enzyme, very important enzyme known as, we can say, known as lipogen lipase enzyme is there. Lipogen, please note it down, lipogen lipase enzyme is there, or it is also known as lipoprotein lipase. It is also known as lipoprotein lipase enzyme is there. So this enzyme, what will it do? It will convert or break down these triglycerides into simple form of amino acids. Wow, the already we are having rich blood supply of glucose from the liver, from the GI system. Lungs are ventilating, heart is pumping hard, pupils are dilating, and there is increased formation of aqueous humor. Liver is providing glucose, pancreas is providing glucagon, blood vessels are breaking down triglycerides into amino acids. So if we administer patient beta blockers, this we can say triglycerides, these triglycerides are not going to be broken down into amino acids, therefore providing less energy. Obvious, glucose means energy to the skeletal muscles, and it will further cause fatigue. Skeletal muscles, yes please, skeletal muscles, it will cause fatigue, weakness, yes, weakness, and orthostatic hypotension. It will also cause low glucose supply to the heart, muscles, brain, and brain will not be able to work properly. Heart will not get proper glucose supply. So till now we had seen that on one side there is sympathetic nerve system activity, and on the same opposite side we had discussed about the we can say reverse effect, or how these beta blockers reverse the normal physiological process. So this was all about the mechanism of the, we can say, beta blockers, beta 2 blockers and beta 1 blockers.